Chronic pain and depression, a dual-edged sword.
Living with chronic pain is enough of a burden for anybody. But add depression, one of the most common problems faced by people with chronic pain, and that burden becomes overwhelming. Depression magnifies pain and makes it harder to cope. However, chronic pain and depression are not inseparable. Effective treatment relieves depression and can make chronic pain more tolerable.
Chronic pain and depression, the sum of the parts.
According to studies conducted and published in the Journal of the American Medical Association, the World Health Organization, and information from the National Institute of Mental Health, the American Pain Foundation, and the Center for Mental Health Services, the following statistics are true of people with pain and depression. About 6 million people are affected by late-life depression, but only 10% ever receive treatment. 1/4 to more than 1/2 of patients who suffer with pain are also depressed. On average, 65% of depressed people also complain of pain. About 42% of adults in the United States report pain lasting longer than 1 year. People whose pain limits their independence are especially likely to get depressed. Because depression in patients with chronic pain frequently goes undiagnosed, it often goes untreated too. By the year 2020, it is estimated that depression will be the second most common health problem in the world. There is good news, however. Depression is one of the most treatable illnesses. An astounding 80 to 90% find relief through an appropriate treatment setting.
Chronic pain and depression, the terrible two.
According to the recently released 2011 Institute of Medicine report, chronic pain affects at least 116 million American adults, which is more than the total affected by heart disease, cancer, and diabetes combined. That means 1 out of every 3 people in the United States lives with some type of chronic pain. Chronic pain and depression are two problems that often overlap. Depression is one of the most common psychological issues facing people battling chronic pain, resulting in sleep disturbances, loss of appetite, lack of energy, and decreased physical activity. All of these worsen pain and further complicate the patient's conditions and treatment.
Chronic pain and depression, a vicious cycle.
Depression aggravates your pain and makes it last longer. Pain and depression takes over a person's thoughts and feelings. This leads to more pain, leading to more depression, which leads to even more pain, and back again to more depression. It's a vicious cycle that's hard to break. According to Dr. Jonas I. Bromberg, about 1 out of every 3 people with pain also has significant depression. And people with pain, especially the elderly, have a greater risk of developing depression than people who don't. Pain provokes an emotional response in everyone. Anxiety, irritability, and agitation are normal feelings when we're hurting. Normally, as pain subsides, so do these responses. But what if the pain doesn't go away? Over time, the constantly activated stress responses can cause multiple problems associated with depression. Those problems include chronic anxiety, confused thinking, fatigue, irritability, sleep disturbances, or unintended weight changes.
Chronic pain and depression, the biological bonds.
Biology explains some of the connection between depression and chronic pain. Depression and chronic pain share some of the same neurotransmitters. They also share some of the same nerve pathways, which explains why the impact of chronic pain on a person's life overall contributes to depression. Once depression sets in, it magnifies the pain that is already there. Depression adds a double whammy to chronic pain by reducing the ability to cope, says Beverly E. Thorne, professor of psychology at the University of Alabama and author of the book, Cognitive Therapy for Chronic Pain. Research has compared people with pain and depression to those who only suffer with chronic pain, and found that those dealing with both report more intense pain, feel less control over their lives, and use more unhealthy coping strategies. Because chronic pain and depression are so intertwined, they are most beneficial being treated together. In fact, some treatments can improve both chronic pain and depression. Bromberg says, experts agree on 4 main facts about pain and depression. 1. Pain occurs with depression as often as it occurs with anxiety. 2. The higher the number of painful body areas, and the more that pain interferes with daily life, the higher the risk of becoming depressed. 3. Some symptoms of depression, like low energy, sleep problems, and worry, are common among pain patients, while other depression symptoms, like guilt and loneliness, are not. And 4. Depression often appears soon after a chronic pain condition starts.
Treating chronic pain and depression. Ready, set, go.
The best way to approach managing chronic pain is to team up with a physician to create a treatment plan. When chronic pain and depression are combined, the need to work with a physician is even greater. Here's how to get started. See your primary care physician and tell them you're interested in gaining control over your chronic pain. Then, as you develop a plan, keep in mind that the ideal pain management plan should be multidisciplinary. If your physician is not trained in pain management, it is best to ask for a referral to a pain specialist. Empower yourself by accessing available resources. Several reputable organizations are devoted to helping people live full lives in spite of chronic pain. And, find a cognitive therapist near you with experience in the treatment of chronic pain.
Treating chronic pain and depression. Take all of me.
Unless pain-related depression is properly managed, it can lead to more problems and a worsening of pain symptoms. Aggressive management of depression makes pain treatment more effective. Since chronic pain and depression affects a person's entire life, ideal treatment will also address the same areas and will most likely include antidepressants. The fact that chronic pain and depression involve the same nerves and neurotransmitters means that antidepressants can be used to improve both chronic pain and depression. People hate to hear, "It's all in your head." But the reality is, the experience of pain is really in your head, says Feinberg. Antidepressants work on the brain to reduce the perception of pain. Historically, tricyclic antidepressants have been effective. However, because of the side effects, their use is often limited. Some newer antidepressants are now prescribed by doctors to treat certain painful chronic syndromes and seem to work well with fewer side effects. Continued physical activity. Lack of physical activity makes both pain and depression worse. Taking part in an appropriate exercise plan can lessen or prevent symptoms. Exercise also helps treat depression. Physical activity releases the same kind of brain chemicals that antidepressant medications control. Many people with chronic pain avoid exercise because of the fear that it will make the pain worse, but in fact, the less you do, the more out of shape you become, leading to higher risk of injury and worsened pain. The key is to break this cycle. Regular physical activity is a crucial part of managing chronic pain. Consult with a physician to design an exercise program that is effective for you. Your mental and spiritual health. Chronic pain affects your ability to live, work, and play the way you're used to. This can change how you see yourself, sometimes for the worse. When somebody begins to take on the identity of a disabled chronic pain patient, there is a real concern that they have sunk into the pain and become a victim, says Thorne. Fighting this process is a critical aspect of treatment. People with chronic pain often end up sitting around, which leads to apathy, disinterest, and depression. The best thing is for people to get moving and take control of their lives. Working with a healthcare provider who refuses to see you as a helpless victim is a large part of the formula for success.
Treating chronic pain and depression. I think I can.
Is there such a thing as mind over matter. Can you think your way out of feeling pain? It may be hard to believe, but research clearly shows that for ordinary people, certain kinds of cognitive training improves chronic pain. In cognitive therapy, a person learns to recognize the negative, automatic thoughts that accompany chronic pain. Remember, these thoughts are often distortions of reality, and with training, we learn to recognize them as such. With practice, one learns to replace the negative thoughts with a more realistic and positive self-evaluation. Remember the children's story by Watty Piper, The Little Engine That Could. The little engine talked himself into meeting the challenges he faced head-on. Through positive thinking he achieved his goal despite his limitations. Using the same type of self-talk, one can change their perception of pain. Thorin says, "There's very good evidence that cognitive therapy can reduce the overall experience of pain." Cognitive therapy also helps reduce symptoms of depression and anxiety in chronic pain patients. In one study Thorne conducted, at the end of a 10-week cognitive therapy program, a significant 95% of patients felt their lives were improved, and 50% reported less pain. She says, many participants also reduced their need for medication.
Please ask your physician about available cognitive therapy resources or contact your local mental health center for availability in your area. We hope you enjoyed this presentation. Please look for our other information videos.
For more information, visit us on the World Wide Web. Chronic pain and depression. www.pain-and-depression.com